Welcome everyone to this webinar focused on maintaining stroke as a priority. I'm Sarah Belson, International Development Manager at the World Stroke Organisation, and it's my pleasure to host this webinar today, brought to you by the World Stroke Organisation, the World Stroke Academy and Stroke Connector, the new online hub for World Stroke Organisation members. The webinar runs for an hour and is recorded and available on the WSO website. After the presentations, there will be a Q&A session moderated by one of our speakers, Dr. Patrice Lindsay. This is the third of a series of 3 webinars and contributes to WSO's priority to build awareness and knowledge of stroke. The webinars have been delivered by representatives of WSO's Global Stroke Support Organisation network. These organisations play a vital role in driving improved stroke outcomes across the world. The webinar series has focused on the impact of COVID-19 on people with lived experience of stroke across the stroke pathway, and on responses and innovations of stroke support organisations to the needs of people with lived experience, and we've shared patient education resources available globally. Each webinar has looked at 2 areas along the stroke care pathway: pre-hospital emergency and inpatient care, stroke rehabilitation and community participation, and discharge, transitioning home and secondary prevention. Today's webinar is focused on discharge, transitioning home and secondary prevention. Our speakers today are Craig Pankhurst from the stroke support organisation A Stroke of Luck in the UK, which is a member of the World Stroke Organisation, Juliette Bouverie, Chief Executive of the Stroke Association in the UK, and Dr. Patrice Lindsay, Director of Systems Change and Stroke Programme at the Heart and Stroke Foundation, Canada. Our first speaker today is Juliette Bouverie. Juliette has been Chief Executive of the Stroke Association in the UK since June 2016. Juliette co-chairs the Stroke Delivery Programme Board with the National Health Service England and is a member of the National Health Service Assembly. She's World Stroke Organisation Board Member and Fellow. And Juliette was recently awarded an OBE in the Queen's 2020 New Year's Honours List. So over to you, Juliette.
Okay, so good afternoon, everybody. I'm going to talk about discharge and transitioning home, and I'm going to share with you what we have learnt about the needs of stroke survivors during the coronavirus pandemic, but also how the Stroke Association as an SSO in the UK has responded. So I thought I would just start off with explaining what the guidelines indicated should be in place before the coronavirus pandemic hit us. So in the UK, we have national clinical guidelines for stroke that have been developed with the Royal College of Physicians. And those guidelines prescribe that all stroke survivors should have access to specialist stroke rehabilitation, that treatment at home should begin within 24 hours of discharge, and that everybody is entitled to up to 6 weeks of specialist stroke rehabilitation offered through an early supported discharge team. And then following that early supported discharge service, which may include physiotherapy, occupational therapy, speech and language therapy, and any other rehabilitative therapies that are helpful to the individual, then people should be offered a 6-month review and then a follow-up review 12 months after their stroke diagnosis, and then each year thereafter. So what did we know about the needs of stroke survivors in the UK before COVID-19? Well, the sad reality is that we know that too few stroke survivors were actually accessing the rehabilitation that the guidelines said they should be getting. So we know from extensive surveys that the Stroke Association has done with stroke survivors and their carers that 45% of them told us that they feel abandoned once leaving hospital, that they feel like they've fallen off a cliff and that they are left to fend for themselves. Only 32% of stroke survivors told us that they were benefiting from a 6-month review after their stroke. And 1 in 4 stroke survivors told us they just did not receive enough support when they needed it most. So the most frequent complaint that we had from stroke survivors was around lack of access to physiotherapy, with people either saying they didn't get it at all or not for the full 6 weeks, and certainly not thereafter. And also people feeling that their emotional support needs were overlooked. And that applied just as much to carers as it did to stroke survivors, with carers reporting that they felt that both their practical and emotional support needs were overlooked. So how has the pandemic impacted the needs of stroke survivors in the UK? What the Stroke Association has done in the last 4 weeks is launch a survey to really understand what the lived experience of stroke and coronavirus is in the UK. And we've been overwhelmed with responses. The survey is still live and we've had nearly 2,000 responses to our surveys, and it's really rich. And I think it may not surprise you to know that stroke survivors continue to tell us that they're feeling abandoned. They know that their time in hospital is much shorter than it was before. They're not getting access to the inpatient rehabilitation that they were before. And now they feel that they're being moved out of hospital even more quickly, and that community stroke rehabilitation is just not there. They're also reporting to us that it feels like the care is not joined up. So even less communication between the hospital and primary care, people finding it difficult to access community and primary care services, and people's outpatient appointments being cancelled. One of the other things that we've learned through coronavirus is that actually some stroke survivors have adapted quite well to digital and phone methods of communication. Some stroke survivors have told us, in fact, that they rather like being able to practice their speech and language online. But others, particularly those who've had more severe strokes with more acute communication challenges or cognitive challenges, have found communicating remotely via phone or digital really difficult, and they have felt even more excluded and socially isolated than before. And we're also hearing worrying stories about stroke survivors feeling even more anxious and depressed than they were previously. They just feel that they've experienced a double whammy. Not only have they experienced the challenge of a sudden brain attack with all the physical and mental challenges that come with that, but they're also having to deal with coronavirus, the fears around coronavirus, and the social isolation that comes with it. And family members and carers, not surprisingly, are also reporting feeling even more overwhelmed with their responsibilities, and that because there isn't that community stroke rehabilitation in place, that they're actually having to provide even more support than they were previously, without necessarily the training and the tools to do that. And here's just a sample of some quotes from stroke survivors and their carers that help, I hope, to bring the survey findings to life. So this is a stroke survivor saying that the care they received in hospital was fantastic. The ambulance crew, The doctors and the nurses were all wonderful. But sadly, in the outside world, it's nothing but COVID-19. Everything else has been ignored. And they just feel that their stroke has been overlooked. And another stroke survivor saying it's hard to access post-hospital services. My GP and pharmacist have been great, but there's nothing else really. And here's some quotes from some carers. The first one is heartbreaking. I've needed to be a physio, a psychologist, a friend, a communicator, a carer, a motivator, and much more. So I think that brings to life the multiple strains and responsibilities that our carers are facing at the moment, with no prospect of getting a respite break in the near future. And the situation has put me under extreme pressure. And here are some quotes from some family members. We just feel so frustrated that not only did the stroke happen, but the timing meant we got less care than normal. And then somebody talking about their mum with severe dysphasia, no speech therapy for 5 weeks, limited speech therapy whilst in hospital, and that severely impacted on her recovery and well-being. And then the final quote tells a similar story. We feel that my father's care, follow-up and any further rehabilitation has been zero since discharge. So I think what these quotes show is that coronavirus has had a really serious impact on our stroke survivors, and that they're feeling even more frightened, abandoned and isolated than they were before. And now we're starting to get increasing evidence, aren't we, that coronavirus is now a risk factor for stroke. We know that coronavirus seems to be causing complex neurological problems. And so what we may be seeing is not just the normal impacts of a stroke, but even more complexity and even more need for ongoing stroke rehabilitation in the short to medium term. So how has the pandemic impacted the stroke pathway in the UK? Well, the NHS in the UK were very quick to publish guidance prioritising early supported discharge and community rehabilitation. And 32% of respondents to a recent British Association of Stroke Professionals survey did report that actually there was more frequent use of early supported discharge, but only 10% reported no impact on rehabilitation, and many of our stroke physicians commented on a reduction in both community rehabilitation opportunities and reduced quality of rehabilitation. So I think once again, we're seeing a gap between the policy rhetoric and the actual reality. So I'm going to move on now to how the Stroke Association has responded in the last 3 months. So very, very quickly, we have adapted and developed our services. So with effect from the middle of March, when lockdown happened in the UK, all of our stroke coordinators who would previously have done home visits face-to-face started providing support remotely via phone and online using channels such as Facebook, WhatsApp, Zoom and Skype. And I think it's fair to say that there was a reticence and a reluctance to embrace those channels, both from stroke survivors and from some of our staff and volunteers. But now it's extraordinary how they've adapted, and this is becoming more part of their business as usual. We've also created 2 brand new services. So Here For You is a volunteer-led telephone service that connects stroke survivors and volunteers to help combat isolation and offer peer support. And we've trained volunteers in a 2-hour session to offer 12 weeks of connecting and chatting with stroke survivors who are feeling particularly vulnerable, frightened and isolated. In partnership with NHS England, we've also launched a new service called Stroke Association Connect, which basically means that every newly discharged stroke survivor gets a follow-up call from a trained Stroke Association expert who can help to provide information about their stroke, help to give them information and advice about how they can rebuild their life after stroke, and can connect them in to local and national support services. We've also increased our financial hardship grants to people during this period. We've increased the capacity on our stroke helpline. We've updated our website, which now has really comprehensive pages about stroke and coronavirus, including pages on how you can stay active during the pandemic. There's some really, really nice videos online which help people with very, very simple ways of taking exercise and keeping active, and lots of resources around how to support your own emotional health and well-being during this period. The website has also got all of those resources available in easy read materials for people with aphasia. And we've also produced a guide for people with aphasia on how to get online. So I'd just like to share with you a video that we've created during this coronavirus pandemic to describe the support that the Stroke Association can provide during this period.
This is a coronavirus situation. My stroke happened on the 6th of September 2018. I set off to go running early in the morning before my children woke up. And then the next thing I knew, I was in an ambulance.
Often we're the first people that someone sees when they're discharged from hospital. And people are lonely, they're confused. I
came into contact with the Stroke Association at Lewisham Hospital. They did a really beautiful thing. Strokes are very lonely, they're a very lonely experience. And she just sat and listened. Proper lifesaver.
It's just educating people really and talking to them about what options they've got, how to adapt their lives to make sure they can still rebuild their lives after the stroke.
You're gonna feel isolated.
At this difficult time, many stroke survivors are having to leave hospital earlier than normal, and the new Stroke Association Connect service is vital in supporting the NHS respond to this new challenge from coronavirus by helping people with stroke just at the point where they need it most, just after leaving hospital.
I think the Stroke Association Connect service is invaluable to someone who's just left hospital.
I know it's a difficult time at the moment, isn't it? Often people are lonely, they're confused, they feel abandoned once they've left hospital. That 24-hour support is gone, and that's where we come in. Stroke survivors can absolutely still rebuild their lives after a stroke in lockdown. You just need support to help them to do it.
There's a lot of dark times. With the Stroke Association, they help you see some light.
So in addition to adapting and developing new services, we've also been supporting our volunteers to work differently. We've been training our volunteers to use new platforms like Skype and Zoom. We've been focusing a lot on supporting the emotional well-being of our volunteers, but also providing them opportunities to have a break. And we've been doing a lot in the UK to raise awareness of stroke as a medical emergency. I know that this has been covered in other WSO webinars, but we've seen a global trend at the beginning of the coronavirus pandemic of people not presenting at hospital with emergency symptoms, including stroke symptoms. And so the Stroke Association ran a campaign to emphasize the importance of stroke as a medical emergency, and that if people experience the signs and symptoms of stroke, they must act fast and call 999. And we've been really encouraged that that message has now been picked up and the campaign supported by the NHS and governments across the UK. And we've also been advertising on radio to get similar messages across. So just to finish up, what are we learning about stroke and about how to operate effectively as SSOs during this coronavirus pandemic? Well, I think it's fair to say that the pandemic has increased stroke survivors' feelings of loneliness and abandonment, and we absolutely need to make sure that rehabilitation is prioritised and that stroke remains a clinical priority for governments across the UK. And I think we've really learned how important it is that a one-size-fits-all model does not work, and that actually a personalised approach to care is really required. But it's also shown the stroke community that we can adapt and develop services at pace. But for me, there's something very important about making sure that we evaluate those interventions to understand which ones work and are right for the future. And what are we learning as an SSO from COVID-19? Well, I have to say we're a charity with a really clear strategy and strong values. And that strategy and those values have been our North Star. They've been our guiding star and have helped us to prioritise, make rapid decisions and act quickly. We've just known what the right thing to do is to support stroke survivors and the NHS. And we've shown remarkable resilience, agility and innovation, and challenged a number of previous truths that actually support could only be provided face-to-face. Well, we know that that is now untrue, and that actually a blend of face-to-face, digital and telephone may be the right mix for the future. There's been fantastic collaboration, both within the charity, with the wider stroke community, and with other charities. And that's a really good thing, because none of us can tackle stroke on its own. We all need to work together. I think for me, as the chief executive of a large SSO, I think the thing that I've really learned is just how important visible leadership is during a time of crisis, and how vital it is that as a chief executive, you're proactive, you're open in your communication, but that actually you can engage with all different types of stakeholders remarkably well online. And finally, COVID-19 has sadly really brought into sharp relief the health inequalities that are only getting bigger as a result of COVID-19. And that's forced us to reflect on what we as an SSO need to do more of to invest in research, but also address the inequalities that exist in access to and quality of services, and that diversity and inclusion need to be a much bigger strategic priority for us going forwards. Thank you. Here's just a list of some of the resources that we've created, all of which are publicly available on our website, and we will be sharing these afterwards. So you can find out more about our Connect service, the information on our website about coronavirus and stroke, My Stroke Guide, which is our online platform where stroke survivors can chat and offer each other peer support, and also Here For You, our new telephone service. So thank you.
Thank you very much, Juliet, for sharing your experiences at the Stroke Association in the UK. And I know that many stroke support organisations around the world will be particularly interested in the way that the Stroke Association has adapted its services and the online resources that you now have available. Thank you. Our second speaker today is Craig Pankhurst. Craig launched a stroke support organisation, A Stroke of Luck, in May 2019, only a few days after the first anniversary of his stroke in April 2018 at the age of 39. Married with 2 daughters, Craig is a keen sports fan and spent his younger years swimming and playing football, becoming an international swimmer in the 1990s. In a blog Craig shared with WSO last year, he noted that he has always been a very motivated individual who thrives on setting goals. He believes these traits will continue to support him in his recovery. A Stroke of Luck combines Craig's pre- and post-stroke life to support the recovery of stroke survivors using physical exercise.
Hi, my name is Craig Pankhurst and I am a stroke survivor from the UK. Just over 2 years ago, on the 28th of April 2018, I had my stroke. It was a Saturday morning. I woke up and opened my eyes and the room was pitch black. That only lasted for a split second or so, and when light did enter my eyes, it's as if the room was rotating out my right eye in one direction and out of my left eye in another direction, which made me feel incredibly ill. When I went to hospital, it was identified from the CT scan and the MRI scan that I did have a stroke, and the cause of my stroke is a dissection to my cerebral artery. Fast forward 2 years, and I'm delighted to say that my recovery and rehabilitation has been a very positive one. But that's in part due to the amazing support network that I have around me, and also my focus on remaining as active as I possibly can to support my physical, mental, and emotional well-being. In the immediate aftermath of my stroke, I struggled to articulate to my children, especially my youngest daughter, who was only 8 at the time, how I was feeling, and neurofatigue is the biggest challenge that I face. So I came up with a very visual system for Reef, who is my youngest daughter, to understand, and that is just a very simple traffic light system: green, amber and red. So when I'm in my green zone, like I am now, I can talk and I can walk and I can function pretty much as I could pre-stroke, with slight concentration deficit and slight left side weakness. As I fatigue during the course of each and every day, I move into my amber zone. And when I'm in my amber zone, my speech will slow down, my thought process will slow down, I may get words in the wrong order when I'm speaking, and my left side becomes more noticeably weak. And if I don't rest suitably at that time, I then move into my red zone. And when I'm in my red zone, I could be sat opposite somebody, they could speak to me, I would understand everything they're saying. But if I try to give a verbal response, I may just grunt. If I try to give a physical response, my right side would move, albeit slowly, but my left side can't really move at all. And during the immediate aftermath of my stroke, I made the decision that I wanted to support other people that had stroke. My background before I had a stroke, years in the past, I was a former international swimmer, and my degree is in sport and exercise sciences. So being active has always been an incredibly important and kind of main focus of my life. So I made a decision I was going to start a charity, and that charity is called A Stroke of Luck. And A Stroke of Luck's branding is in green, amber and red, which mirrors the strategy that I adopted in trying for me to communicate how I was feeling at any particular time. And the focus of our charity is to support people in life after stroke, and to support them most specifically around being as active as they possibly can. We are currently collaborating with the Stroke Association in the UK, creating stroke-specific exercise and activity videos which will support stroke survivors in their ongoing recovery journey from stroke. Be it whether a stroke survivor has just left hospital and has the need for 24-hour care, these activities will be absolutely appropriate for those survivors, right the way through to stroke survivors who are independently mobile and able to exercise independently. And this is a collaboration between A Stroke of Luck and the Stroke Association that we're all extremely excited about. Now, we know that secondary prevention of stroke is very, very top of people's agenda and absolutely is front and centre of what A Stroke of Luck are doing. It's about supporting that ongoing recovery journey and preventing a second stroke. And it's our belief, and when you look at all of the research out there, that by having a healthy lifestyle as you possibly can, which means balanced diet and it means remaining active, the chance of having another stroke is greatly reduced. So I'd be delighted for those of you that want to engage with a stroke of luck wherever you are in the world. We have a YouTube channel where in a few weeks' time we will be posting a library of resources of these exercise and activity videos. And by all means, join in being active. But yeah, just be, everybody stay safe, and I hope your recovery journeys are as positive as mine. Okay, thanks very much. Bye-bye now.
I think you'll all agree that Craig's input is really inspiring. Craig has become an incredible ambassador for stroke support organisations, both within the UK and internationally, and is connecting with our stroke support organisation network around the world. So thank you, Craig, for joining up the webinar today. And our third speaker today is Dr. Patrice Lindsay. As the Director of Systems Change and Stroke Programme at the Heart and Stroke Foundation in Canada, Patrice leads strategic directions for system change and knowledge translation across Canada, and is Senior Editor for the Canadian Stroke Best Practice Guidelines and lead author of the World Stroke Organisation Global Stroke Guidelines and Roadmap. And just before I hand over to Patrice, please don't forget to post any questions you have for Patrice or for Juliet in the Q&A function. Thank you, and over to you, Patrice.
Thank you so much, Sarah, and I'm really pleased to be here today, and thank you to everybody who's joined us from all over the world. In the chat, you can see people acknowledging and saying hi from their different locations. Well, on March 11th, 2020, the World Health Organization declared a pandemic. We're now 112 days, 2,688 hours, 161,000 minutes, and over 9 million seconds from that life-changing moment for everybody around the globe. So we really appreciate you taking time to be with us today. I'm going to talk to you a little bit about, from the secondary prevention perspective. So we'll talk about, first of all, why does COVID matter? What are the implications for prevention? Some of the challenges and tips for accessing the care you need, what the guidelines say you should get, and what's happening now. And then really the rest of it's going to focus on taking action. What can we all do to move forward in this new and unprecedented environment? So first of all, and you've heard this I'm sure before, is the virus does have the ability to impact both the heart and brain. It could lead to blood clotting, it could lead to other changes in tissue, and put the heart, basically the whole body at stress, which increases your risk of stroke and heart disease. And new data shows that it could even lead to abnormal rhythm problems, such as atrial fibrillation, which again is a high risk factor for stroke. So on the sad side, the research that's coming out now, and we're still in early days, but a lot of data has been coming out in case studies from different organizations around the world that have been dealing with COVID, saying that people who've had a previous stroke are 3 times more likely to not survive if they do get COVID. And people with hypertension are also at higher risk. So it's really important that we address prevention and deal with some of these risk factors. So these are just some clippings and headlines, and really the message here is that we've had some lost opportunities. Everybody is scared. I'm scared. Everyone I work with is scared. We understand that. Unfortunately, people have been scared to the point where they're not acknowledging symptoms of stroke or acting on them unless they're really severe. What we're hearing from all around the world is that if you are having loss of movement, loss of function of one side of your body, then there's more likely to make a medical visit to the hospital. But if your symptoms are milder and if they do start to resolve, such as in the TIA, people aren't presenting for medical care because they fear the virus more than they fear any potential after effects of their stroke. And we've heard that many times. The downside of that is you can end up with another event and a worse event. So we understand the scary, but if you need help, the hospitals are prepared to get it. As you saw in my previous slide, a lot of the emergency departments were quieter than they've ever been. So, and they've all taken extreme precautions to make sure you're safe. So the bottom line is knowing that there's a higher risk for people with stroke. With the coronavirus, prevention is more important than ever. And around the world, our organization, Juliet's, the Australian organization, Brazil, all over the world, people are really working with people who've had at least one stroke to ensure that they don't have another and to ensure they're safe and the risk is reduced. So as we talk about what you can do from a secondary prevention perspective in this new environment, let's just understand what secondary prevention is. So it's after you've been to hospital, and as Juliet talked about, those first days when you've been released from hospital, but then secondary prevention becomes a lifelong activity for you and just becomes part of your daily routine. Secondary prevention involves working with teams, that there's structures and processes of care, referrals, diagnosis, treatment, getting you all sorted out, and then really looking at your outcomes, including quality of life. So what happened during the pandemic with stroke prevention? Well, the team, first of all, in the structures, everybody switched to virtual care. No outpatient services, at least in Canada, were happening unless extreme circumstances. And those things that you cannot do from a distance, such as injecting Botox if you have spasticity. So most other care has been gone virtual in the ambulatory or stroke prevention setting. Normally when you go to a stroke prevention clinic, you would have a whole team that would see you in successive order. The nurse and then the physician, maybe a resident, the dietitian, and possibly the physio or speech therapist as needed. Well, that's not happening because you're seeing one person at a time through video. The referrals, there is a backlog. Some have been delayed or rescheduled or switched to virtual. For diagnostic access to CTs, if you really need a CT or MRI and it's declared urgent, you will get one. But otherwise, you're, more electively booked one to see what may have happened, or your cardiac monitoring for potentially, those are being delayed or reduced at this time. They're just starting to ramp up now. So medication access has been a major issue for people living with stroke and with other conditions. I know in Canada, the pharmacies limited us to a 1 month supply, yet at the same time said don't go out unless you have to. So going to 1 month at a time meant people had to go out extra times to get to the drugstore to get their refills. And then, for all of this kind of lead, as I mentioned earlier, is potential for a negative impact on outcome. So it is really time for action for all of us. First of all, as Juliet mentioned, all the major stroke societies around the world put out guidance regarding how to handle stroke care in the COVID era, including us in Canada and the stroke best practices, and we did a section specifically on secondary prevention. We said that they must continue to be implemented because reducing stroke incidence is a really critical part of our care right now, because we know that those with additional stroke are at increased risk of COVID. Everyone switched to telemedicine. What we've been promoting is through the World Stroke Organization several years ago, we created the post-stroke checklist, and many countries have adopted it. And so we're really pushing that people's care should be aligned to the post-stroke checklist, even in the COVID and virtual era. And that people presenting within 24 hours, for potential TIA or mild stroke, do need a CT scan and ECG, and that can't be delayed or waited. So just as a reminder, this is what the post-stroke checklist looks like. So it really deals with all of those pieces that you need to live with long term and that really need to be managed in consultation with your healthcare team. So I won't go through all the pieces, but it is available both on our website and at the World Stroke website. So a major piece that happened in secondary prevention is the switch to virtual care. Secondary prevention clinics and ambulatory services became almost exclusively virtual. So it's really important that what's happened is many of the staff, so the physicians, the nurses, the ODs, they've actually never used virtual care before. So it was a learning curve for them. And more importantly, it's been a learning curve for both patients, for their family members, both in access to technology, but also in how to use it. So whether you have it and know how to use it. And then that brought up a lot of issues around privacy. How do you protect your privacy in this virtual era? I had several patients say, older patients, I had to get my grandson to come and get me all hooked up for my virtual visit, but I didn't want them knowing my business or knowing what was going on. So I sent them to the basement during the visit and told them I'd call them if I need them. So all of these extra things we need to think about in providing secondary prevention. So other considerations, there's huge ability with prevention, with secondary prevention and virtual care. With wearables, there are ways to monitor your heart rate. There are ways to check your other parameters, and they can see the imaging as long as you've had it. It can be all seen virtually. So many things can be done for secondary prevention virtually. And what this has taught us is that not everybody needs to go to hospital, and if you don't need to go, you might not want to. And you have the right to ask, do I really need to come in, or can we do this virtually? So at Heart and Stroke Canada, we've created an infographic, which will be available on our website, for how to have a good virtual visit and how to be an active participant. On the front is general tips for preparing for virtual healthcare visits of any kind. But on the back, we specifically then broke it up for stroke prevention and for stroke rehab. And I'll just highlight the prevention. So if you're going to be participating in virtual care, be ready, be prepared, and be active in this just as you would if you were there in person. So, you may want to have others participate. I had a great story from a physician who said they used Zoom and had 5 family members from all 5 different locations joining the Zoom meeting with the parent that was the actual patient. And when the physician asked, put her finger up to the camera and said, please put your finger to your nose and then try to touch my finger on the camera. Apparently all 5 family members that were watching also joined in. So everybody got their neuroscience assessed at the same time, which was great. Before the session, make sure you understand what's going to be done during the session and whether there's any testing or results that need to be available before that, and whether there's something you need to do. During the session, make sure you have your question list and be prepared to answer. If they're going to test neuroscience, they might ask you to have ice cubes or a toothpick ready, and then you can actually, rub the ice cube on both sides of your hands and see if it feels the same and if you can sense it. So you can do your own neuro assessment with the guidance of the healthcare provider. It's also important to have a medication list available with you so that when they ask you questions about that, or if you want to know about renewals, you're reminded of all the pieces you're on. Many people have been worried about their blood pressure because the home or the drugstore and shopping mall blood pressure machines have all been removed because of COVID. So we encourage you to talk to your physician or your pharmacist about whether purchasing the blood pressure cuff is the right thing for you to do, how important it is, and also which ones are more affordable or better quality, because not all blood pressure machines are created equally. But that's a critical part of managing your risk factors post-stroke. Like other countries, we've been very concerned about the ability. So an important part of prevention is knowing the signs of stroke. And I know that sounds weird if you've already had one, but it's amazing how many people and how many families don't really know these signs even after somebody they knew had stroke. So we've been heavily pushing it, and we've modified our messaging that stroke is still a medical emergency. Don't hesitate, even during COVID, you still need to reach out. And 911 is our emergency response number in Canada. So different groups have modified our different assets to be relevant during the COVID period. So really importantly, again, the most important part of prevention is that you take charge. That you and your family take charge, that you practice self-management and self-care, and advocate for yourself. In this really uncertain time when you're scared and unsure, it's not the time to kind of just back away and say, oh, I hope everything works out and I'll just see what happens. It's the time to take control, to advocate for yourself, to contact your medical team, say, you know what, I really need help. Especially for things like new symptoms, changing or worsening symptoms, issues with access to medication, mental health, and as Juliet said, this has been a major issue for everybody, and even more so for people who are living with chronic conditions. And then even things as basic as transportation alternatives if you can't get to a clinic visit. So for yourselves, for self-management, make sure you know your pharmacist. If you've got your medications all being dispensed at a certain pharmacy, get to know the pharmacist, let them get to know you, and they're there to assist. And we've worked with many pharmacists over the last months, and they've been terrific. They're willing to go the extra 10 miles to help all of their customers to make sure that their medications are continuous, that they don't lose or stop them for any period of time, whether that be because of financial difficulty or even being able to get to the pharmacy. Another important thing is when we heard that they were being reduced, people were starting to stockpile, and that's not good. Partly because medications do have expiry dates, on them, so you need to be extra careful. Medication appointments is another, or medical appointments, another thing you need to think about in self-management. Make sure you know which appointments you had, what's happened to them. If you don't have new dates, I would push to get those new dates and to find out whether it can be virtual or needs to be in person. We strongly encourage you, if you have an appointment and it's still happening, not to miss it. Even during COVID, there's extreme precautions being taken for your safety, and missing your appointments can put your health at risk. If you need blood work, sometimes things like if you're on blood thinners and you're going every week or other week and adjusting your medication accordingly, sometimes those can actually be stretched out to 3 or 4 weeks or even 5 weeks. But for you, depending on how stable you've been, you need to talk to your physician first. So other things that are really important and that we've really been pushing, even though you can't get to your gym, there's been an absolute glut of videos, of exercise videos. Now, before you start, make sure you check with your physiotherapist or your physician or nurse about what's safe for you. Because some of these aren't designed for people with stroke, but actually several are. So make sure you check, but continue to engage in an exercise program. Even locked indoors, get out, find a safe place to walk. With the summer, smoking cessation has never been more important than it is now. What we've learned is that, we know that smoking, tobacco, vaping, or cannabis all do affect the lungs. And since COVID is a disease of the lungs, it is much more severe and people are much more at risk, which is where we're seeing a lot of the younger people who've had COVID not do well. It's related to smoking status. One of the positive benefits is more people have been cooking at home. There's been challenges getting your groceries and that, but people have been cooking as a family and eating healthier. A very important aspect of this is stress management as part of your secondary prevention. So we had a psychologist working with us and presenting a video. I'm not going to read all this, but some of her advice was make a routine, keep your routine. Make sure you stay socially connected. The term social distancing is a terrible term, and we've stopped using it. It's actual physical distancing. The social distancing leads to isolation. So you can still be physically distant, but engage in social activity. Really don't go into media overload. People were getting so stressed out because of reading everything about COVID. Go to 1 or 2 trusted sources like your local Stroke Foundation or Heart and Stroke Foundation. And we've all been doing a great job at trying to vet through hundreds and hundreds of articles to find the right information to share with you. Focus on what you can control and not the world around you that's a bit out of control at the moment. And be kind to yourself and kind to others. It goes a long way. A really important part of your self-management and managing secondary prevention is to think about the people caring for you. Juliet mentioned some in some of their comments. Your caregivers, your informal family caregivers, have their own needs. And we don't want them to be at risk of a condition. Many of them do have health conditions to start with. So this applies to you and to your caregivers. At Heart and Stroke, over the past 14 weeks, we have conducted 22 webinars of all kinds of different topics for people to manage through COVID. We've got some really interesting podcasts on how the system has changed, where we've been publishing papers and fact sheets and infographics, which are all available on both our Heart Stroke and our Stroke Best Practice websites and through our social media. We've been doing a very extensive outreach and engagement of people with experience, and they've co-developed many of these other resources with us. At Heart and Stroke, we have several resources for people who've had a stroke to help them with their prevention and with all of their stroke journey. And these are all available on our website, and we have adapted many of them for COVID. Most importantly, we've seen a very active engagement of our online Facebook communities. People have been terrific at supporting each other, and that really helps. With your secondary prevention, there's been a lot of questions about how do you solve this? How did you get your meds? What are you doing for exercise? So all of those prevention risk factor management things, people have been helping each other, and peer support is such a powerful thing. And we encourage you to actually look up our Heart Stroke Connect. So I want to leave you with the following key messages. Heart attack, stroke, cardiac arrest are all medical emergencies. Regardless of the outbreak, they're still emergencies. Please come to hospital. People with underlying conditions are at increased risk of serious complications from COVID. Physical distancing does not mean social isolation, so please be aware and reach out to others. There's no scientific evidence to suggest that your blood pressure medication should be stopped or that it increases COVID. That messaging came out in very early days, but the more data we got, the more we were clear that it's not the issue. Please don't stop your medications without talking to a healthcare provider first or a pharmacist. You know, prevention is your best medicine right now. Preventing that other stroke, preventing a new stroke from happening is critical now more than ever. And rehab really needs to continue. So I wanted to leave you with those messages, and I'll stop there so we have time for questions. Thank you very much.
Thank you so much, Patty, for that really comprehensive presentation. And I think what many people will find really helpful is the really practical insights that you've given drawing this changed context. I'll hand back to you, Patty, to convene the questions. But just before I do, just to reiterate to our listeners that we recognise that there's been a few technical issues, and all presentations and videos will be available on the WSO website alongside the recording of the webinars. And we will also include their resources that we've collated from stroke support organisations around the world. So over to you, Patty.
Thanks. The first question will go to Juliet, and I can comment on it as well, is support groups. How have your support groups switched to virtual, and how are they managing in that environment?
Yep, so when lockdown came into effect in the UK in the middle of March, we immediately communicated with our stroke groups and clubs that they should no longer meet face to face. And it was interesting because a number of them said, oh, well, you know, that's going to mean that we're no longer able to continue providing peer support. And so we worked with them to encourage them to set up WhatsApp groups and to start becoming familiar with Zoom. And at the beginning, there was a real nervousness, and they did need some support and some guidance to get online. But now they're absolutely loving it, particularly the WhatsApp groups, because they can be checking in with each other all the time. And if somebody is having a bad day, then one of the group members can give them a ring on the telephone. And all sorts of things are happening on Zoom. I mean, it's brilliant. You know, they've resumed their weekly group meetings. Some are meeting more frequently than weekly. They're doing quizzes, they're hosting coffee mornings, they're baking together. We have a number of aphasia choirs in the UK who are really actively singing away. It's just fantastic. And I think our stroke survivors have really surprised themselves how much actually they're enjoying using the new technology. So I think it's just a question of giving them the confidence and some support at the beginning. But once they're online, they really embrace it.
Great. And, you know, in Canada, we have a visiting peer support program, which had to be stopped during COVID, but they quickly adjusted to virtual, where they're still going in to visit patients peer-to-peer for people they don't actually know ahead of time. And the hospitals have been great at helping facilitate that, and it's been going really well. And as I said, our communities are not live programs, they're Facebook peer support communities and peer-to-peer, and they've been, like I said, very, very active during this time. And we had also conducted an impact survey similar to what the UK did, and heard from many people that having that connection was quite valuable to them.
Yeah.
So another question relates to aphasia. And I know I'm going to talk to it a little bit, and then Juliet, if you'd like to comment as well. Aphasia, people with aphasia have had a greater challenge during this time.
Yeah.
The use of electronics, the use of virtual care. In Canada, we have the Aphasia Institute, which has been a phenomenal World Award recognized institute for people with aphasia after stroke and other conditions. And they have quickly adapted and created some tools. There's lots of speech therapy apps out there, but this has been really how to have a supported conversation by video. When you have audio only, which many people do because they don't have video on their phones or their devices, it becomes a serious problem. And those people are at much more risk for that social isolation part that I spoke about, and really ending up with stress and other sadness, potentially depression, because they really do get isolated in this current environment. So we all need to make a special effort, if you know people with aphasia, to reach out to them. But there are some resources for video We actually have just put up on the Heart and Stroke Canada site 3 little vignettes about how to have supported conversation with someone with aphasia in a virtual world. So we encourage you to watch those. You just have to be patient. You have to take your time. You can't rush them, even on video. You know, all those things you would do in person, those core principles apply. Juliet, would you like to also comment?
Yeah, I mean, I'd say the same thing. I think it's been particularly tough for people with aphasia because they really, some of them have really, you almost find it impossible to communicate by phone or remotely when they can't actually see somebody's body language. They can't benefit from the use of gestures, and just getting online is really complex for them. So I think for those who are severely aphasic, there is nothing like face-to-face speech and language therapy. Nothing will replace that. However, for others, interestingly, they've actually found renewed confidence practicing online. I'm actually a volunteer as well as a paid staff member, and I've been volunteering in our Here For You service, and I support 2 stroke survivors, one of whom is really aphasic. And actually I ring her every week for half an hour. She doesn't know me. I ask her lots of open questions. I'm very patient, and she makes an enormous effort. And now we're into week 8 and we're already practicing using Tactus, the free version of the online Tactus speech and language therapy tool. And we're playing games and it's really fun. And she's completely surprised herself. So, you know, I think it depends how far people are down the road of their recovery. But I think for some people doing it online hasn't been all bad. It's made it in some ways just a little bit more empowering and enabling. So it's courses for courses, and it goes back to the point I made about the importance of personalised care. You really do need to understand each person as an individual, assess their personal individual needs, and then tailor the support accordingly.
That's fantastic. What a great and that's what we all need to do. You know, I encourage everyone to, you know, if you know somebody with aphasia, please make that extra effort. And also people, not just with aphasia, but people living alone. There's a lot of people with stroke, especially elder women, who are living on their own and don't have any support at all. And those are the people who are at greatest risk right now. So we've been reaching out. So that's awesome. We're almost out of time, so I'm going to conclude with one final question that came in asking about blood pressure and home monitoring and teleeducation. So education is probably one of those things that's been at highest risk of suffering through the virtual world. You know, I know many prevention clinics where you normally see the nurse and the physician and the resident, and then the nurse would come back in and do all of your education. You know, we're missing that piece because usually it's one at a time. The nurse might for some places where there's, you know, and I've asked people where there's an electronic health record or some sort of electronic common communication data set, you know, when whoever's seen a patient can go in and put their notes and flag the next person to go and call the patient for something, especially education. But in other places that's not happening, and that's where you need to be your own advocate. And for any of our healthcare providers out there, please don't forget about patient education in this virtual environment, because it's needed more than ever as we're pushing people to self-manage. Home blood pressure is an excellent example. There's a right way and a wrong way to take it, the right time of day, you know, not right after your coffee or your cigarette, sitting in a quiet, restful place. There's really good instructions on many of our sites on how to do home blood pressure, and it is a very valuable thing. There is an issue around payment and being able to afford the machines, but there are actually, I know a couple areas in our northern communities that are actually lending them out to people. So some of the health centers where you're not allowed or you're not going in, they're actually lending them out. So there's all kinds of creative ways to get that, but please look at and follow proper instructions on how to use it. And it does help. It is a way to feel better, feel less stressed, less worried, because you can see the numbers. And even if the numbers are off, the machine's off of it, it's the pattern. So if it's down every day or if it starts to go up and down, you know, those are signs to get reach out to somebody. So I think, Sarah, we'll turn it over to you because our time is up. And I just want to, on behalf of myself and Juliet, thank everybody for joining us. We really appreciate it, and we appreciate everything everybody has been doing to help each other and manage through this very unprecedented time. Juliet?
Yeah, can I just want to second that? I think the stroke community both, you know, I know it from the UK, but I know that globally the stroke community has responded in the most phenomenal way. We've all done the very best that we can to support our stroke survivors during this period. I know it's been really challenging for those of you who are healthcare professionals. I know everybody's getting tired. And you've had to adapt really fast to new ways of working. But I think as a clinical community, we've been very, very impressive. And I think, you know, I have to say, I think we've acted faster and been more patient focused in our response than some other clinical specialties. So I just want to say congratulations to all of you. And many thanks in particular to our stroke survivors who are part of this webinar as well. You're the inspiration, you're the people who keep us going and tell us what's working and what's not. So we can't do this without you. So thank you.
Thank you to Julia and to Patrice. A really, really positive way to end this webinar series focused on maintaining stroke as a priority in the time of COVID-19. I think it's been a great platform and showcase for the work that stroke support organisations are doing around the world in collaboration with other healthcare professionals and decision makers. So just again to reiterate, thank you to you both for your time and for everybody for joining today. We had a wonderful number of people, over 100 people joined us today, and this webinar, as I say, will be on the WSO website under the webinar section. It will form a series with the other 2 webinars that were focused on other stages of the stroke care pathway, and we really hope it will be a useful and valuable resource to everyone. So thank you all for your time. Bye-bye.
Bye-bye. Take care. Keep safe.